a lot of women complain of like low libido, low energy, and all that kind of stuff, but some women actually experience like a resurgence and all of a sudden they're like frisky. So what is happening there? Good morning, everyone. I am Dr. Nicole Smith, nurse practitioner here at Antigravity Wellness, which is a functional telemedicine women's hormone clinic specializing in perimenopause and menopause. We also treat women under 35 for various hormone issues. And we also have a men's service line and an aesthetic line. Oh my goodness, so many things. I help the people. I want to help people. I went to go see M Factor 2. So I've seen M Factor. I was actually part of the panel. We did one in Walla Walla. It was such a great event. And then the M Factor 2 just recently came out, which is all about perimenopause. So if you don't know what the M Factor is, go check it out. They've got lots of social media and stuff like that. And it's a documentary that talks about menopause and perimenopause and treatment and, patient experiences. They have lots of interviews on there with specialists and with patients. And it's really powerful. It's really impactful. They did a really great job with these. And there's this grant where, you can license the rights to show it and then have these events. So people have been throwing these on all over the country, which I think is just amazing because, again, it raises awareness about what is going on with women and we're not alone. So it's a really fun thing to be a part of. So I went to the M Factor 2 and we had one recently over in Kennewick, Washington. I wasn't part of this one. I just was a, audience member, which was kind of cool. Cause I got to sit back and really see how it was impacting the women there. I could hear some conversations that I wouldn't have otherwise heard, cause I was actually sitting in the audience. And I think that's really impactful because then as a provider, I get to hear what it is that's really landing, what it is they're actually struggling with, what are their little side conversations that they're talking about that they may not really feel comfortable coming out and saying to just some random person. Even though you're a provider, they don't always tell you everything that's going on. You have to build that relationship. So who better to hear the girlfriend, talk than the girlfriend, right? But it's helpful for me. I'm not trying to pry in people's personal lives, but you can hear what's going on so that I can help, So that was kind of one of the things. I was doing a little recon there. Got to see the video, which was really great. Most of it was pretty good. There's only one thing that I saw that I was like, that's not exactly true. They said it twice, was that there's nothing you can do to speed up or slow down menopause. A lot of it is predetermined by genetics. However, as with everything in your body, we have modifiable risk factors, which is things you can do something about, and non-modifiable risk factors, which are things you have no control over, like your genetics. So modifiable risk factors include things like smoking, like BMI, how much body fat you're carrying, how much chronic stress you have, how well you're taking care of yourself, basically. Exposures to chemicals, things like that. So those are things that we have control over. If you have high blood pressure, are you managing that? Uncontrolled diabetes, blood pressure, obesity, all of these things are modifiable risk factors that we do have control over. And while it's not going to delay or speed up menopause drastically, we have seen 1, 2, 3, 5-year differences in some of these women. And genetics plays a role in this too. So you might have a more, predisposed to this or that. It's very complex is the short answer. And it depends. But we've seen smoking can make it come a little bit sooner. We've seen higher BMI can make it come a little bit later. Not to advocate for gaining a bunch of weight to try and postpone menopause. But the excess body fat, one of the places where we make estrogen from, we take testosterone and we turn it into estrogen in the body. And men do this too. It's just across the board. But we take testosterone and turn it into estrogen in fat cells. They have an enzyme called aromatase, and aromatase will turn testosterone into estrogen. The more body fat you have, the higher your estrogen levels are. So that's the theory about why having a higher BMI could possibly contribute to having later onset menopause. Kind of interesting. So there was that one little thing that I was like, I don't think so. Another question that got asked of the panel while I was there that they didn't quite explain it how I would have explained it was, why do certain women have increase in libido when they're coming up towards menopause? A lot of women complain of like low libido, low energy, and all that kind of stuff, but some women actually experience like a resurgence and all of a sudden they're like frisky. So what is happening there? Well, progesterone and estrogen are starting to decline, and they tend to decline a lot faster than testosterone. You can have relative testosterone dominance compared to your estrogen and progesterone because they're dropping. It doesn't mean your testosterone is high, but the body will be responding more to that just because the signal is louder in relation to the other signals that used to be there. So you can have things like higher libido, you feel friskier, you might have more chin hairs that show up, you might have a little bit of hair loss that can happen. This isn't always permanent too. Sometimes that little bit of shedding that you get, the little excess shedding, won't actually be permanent. So take heart, okay? As things level back out, the body will figure it out and you'll grow your hair back. And then a little bit of excess belly fat, because testosterone, we see it in men all the time. When they gain weight, they gain it in the center. And that's where also that higher increased risk for metabolic disease and heart disease can come into play as well. So that is why we think so far that you have that little resurgence of friskiness in coming towards menopause, which isn't a bad thing, right? So otherwise, it was a really great event. So I might throw on something a little bit similar. I'm looking at some options. We've done an event before with the pelvic floor physical therapist that I love, Dr. Desiree Lyle over at Raise the Bar Physical Therapy. Betty McLean from Aim for Greatness Coaching. She's a life coach and an RN. She's wonderful. And then we also had Annie come in, who does her own yoga. So we had her come in and do some yoga with us, which was great. So we had that event last year. We're looking at doing another one like that, just to kind of get people together and have like a fun girls' night or girls' day, whatever, and be able to teach and connect with people and give them, that confirmation that you're not crazy, you're not alone, like you are going through something, and to be in a room of like-minded women who are also struggling. So again, you are not alone, and that can be really empowering to know that. So, anyways, I'm going to go to another event today for networking. That is the plan. So no clinic today. The Aesthetic clinic is already booked up for next month, so we're not accepting any more patients there. I do have some openings for hormone patients. So, check the link. We are doing a brand new, I'm so excited, energy reset program. That's the number one complaint. That's one of the earliest signs of perimenopause is low energy and brain fog. So those are the two things that usually show up first. Very nondescript. Goes on for years because they're just like, I don't know, I feel kind of off, but everything looks fine on my labs, right? But they didn't even check your labs. So this is a really great program to kind of figure out where is it coming from. So first you take the energy drain quiz, and the quiz will help you to kind of figure out, okay, based on my symptoms, this is probably my biggest area of concern that could be affecting me. So it could be your thyroid. It could be your hormones, of course. It could be your gut health. It could be glucose and sugar. So those are the things that it can kind of help you differentiate. There's like 5 different ones. So you take the quiz, you get your results, and then from there, if you're interested in learning more, you can go into the Energy Reset program. It's a very low-cost little program. It is not medical treatment. It is more educational to help you figure out what you can do before you even talk to a doctor on your own to figure out, what are my drains? What's draining my energy, and what can I do today, this week, this month to start slowly reversing that process and really taking better care of myself? Because that's really what this is all about. You have to be in charge of your health. And that is my goal, is to give you the education and the empowerment to make those decisions for yourself, and then be able to walk into a provider's office, whether that's mine or somebody else's, and say, hey, I've done this and this and this, and I really think this is what my issue is. And then we can go, okay, let's look into, the functional labs. Let's look at your history. Let's look at your medications, your supplements, everything that's been going on, and figure out, okay, where can we help you to move the needle even further? With this program, you will be able to start to feel a little bit better. It may not reverse all your things because it can be very complex, but relief can be on the other side of this. So I really am super excited. This has been after, the past few years of figuring out what is really driving women. Like, yeah, they come to me for fat loss, but then when we really start talking about it, they're like, I'm too tired to even do all this stuff. Like, I try and do the workouts, I try and do the meal plans, I'm trying to eat less and exercise more, and I'm just exhausted, and I'm actually gaining weight, or I'm not getting anywhere. I'm just spinning my wheels. I'm like, okay, so the problem isn't the body fat, the problem is the energy. So let's figure that out, and then we can start moving the other things along. So that's what this program is all about. So you can check out the link. Oh, what's happening with our hormones when we don't experience the friskiness? Oh, that's a great question. Okay, so for those women who don't feel frisky coming into menopause, what's going on there is some women drop their testosterone more and a more, steady pace than other women. And this is the nuance in women's healthcare in general. We're all different. We all experience these things differently. So some women, instead of having like their testosterone levels, they might start to dwindle, but their estrogen, progesterone drop much faster. So that's where you get that little bit of extra friskiness towards the end there. Other women, everything drops. And that can be very complex. Low iron can do this. You need iron in order to make testosterone and also to make thyroid. A lot of women have low iron. Your vitamin D can be low. You need vitamin D in order to make testosterone. Your adrenals can be super taxed. So if you have chronic stress and your adrenals are just working overtime all the time and you feel like tired a lot, you're likely pulling resources, precursor hormones that would have gone to make testosterone, and instead you're making stress hormones. So that'll drop your libido. That'll drop your testosterone. Low estrogen also can contribute to having lower friskiness, lower libido, lower energy, all that good stuff. So it's kind of complex, but that's the answer to that question. So it's a really good question. Thank you, Josie. All right, I gotta go get ready for this networking event. Done with my workout and my sauna. It's hot in here, so I'm gonna peace out. I will see you guys on the next live. Bye.